out if we do not get people logged on. Okay, so really just we created this little check-in to have like an intentional touch point with you guys. I am going to share a little PowerPoint here so that we can go over just a couple of things. Let's see here. All right. So we love to be able to check in with you guys about 3 months off of orientation, just so that we can kind of see how things are going and get a feel for how you guys are doing. So we're just going to go over like a couple of housekeeping things. How are we doing? We're going to go over some feedback that we've gotten on the unit, just some general, like for your knowledge, go over competencies, annual competencies, our goals, and then we'll have some closing questions and remarks. So to get started, some housekeeping items. So for Vizient, for our new grads, please make sure you are not working the night before Vizient. Our scheduling committee does their best to not schedule you on the night before or the night of, but you also should not be switching on to that shift. If for some reason the scheduling committee, they're making so many schedules, if for some reason they make a mistake and you are shuffled on to that night before Vizient, and you cannot find a switch off, please reach out to Jackie or me or Carly, so that we can help you with that process, because you really should not be working the night before Vizient. We just don't want you guys driving home, after working all night and then being at Vizient for 4 hours, just not safe. Clocking out no lunch. So we have implemented this kind of policy that team members have to inform unit supervisors by 3 or 4 that they have not been able to take their lunch break before that 4 o'clock meeting that our unit supervisors go to. Biggest reason that we implemented this is because we want to prioritize you guys getting out for your meals. So there should really be no reason. I mean, we're so lucky on this unit. We have so many, points of support on our unit. So really there should be somebody who is available to cover your break, to get you out to be able to eat. So if you clock out no lunch, but you have not communicated this to your unit supervisor, just want to let you guys know that Saj will be updating the punch to reflect that a meal break was taken, because we want to make sure that we are prioritizing getting you guys out. Acuity requests. So we've had a couple of you guys reach out to us about, wanting to like further your knowledge, further your skills, continue to advocating for yourself in that regard. Biggest thing that we always tell everybody is we want you guys advocating for these experiences, advocating for a change. As always, we want you to be patient and flexible. We want to make sure that when we are giving you these experiences that you are able to have the support in your neighborhood. So like we want to make sure you have a free charge, make sure that you have an experience charge, things like that, so that when you are at this point where you are taking on those higher acuity patients, that you're feeling all of that support around that and you're not just like thrown to the wolves. Okay. But best way to kind of get your foot out, or your foot in the door, your kind of name out there that you are looking for those experiences, is to be that person who's, being that second set of hands for the intubated patients, throwing yourself into admissions, being that person who's always asking, like, can I help you do X, Y, and Z, things like that. Because that way, when those opportunities do arise, it's very easy for our charge nurses to say, so-and-so has really been like pushing themselves, advocating for their learning. Let's go ahead and give that assignment to them. Some other things. So we have had a lot of issues with leaking 2 ways. Most of you guys are on night shift, so I am sure you have experienced this or have heard about this happening. Always making sure, we have found we're doing a lot of like digging into this, and we found that other units really are not having this problem. So we want to make sure that we are covering every basis like on our end. So make sure that you are avoiding like over tightening or not tightening enough. These, we found in the past that some of our issues have been the plastic like weekends. And so if you over tighten it, it can actually crack, like make little minuscule cracks in the plastic, which can then lead to leaking. So just make sure that you guys are not over or under tightening for those things. Preparing for magnet. So hopefully you guys have all heard that we have our magnet site visit coming up in March, end of March. So we want to make sure that you guys are feeling prepared for that. We did just get an email that you guys will be given little booklets if you guys are working on the days. They go over like magnet designation readiness. You guys will have little like pocket guides for this, so they're a little bit of a smaller version of this book. Make sure you guys are reading weekly updates for question preparation, also looking at our magnet board. I know a handful of you guys do rotate, so we want to make sure that if you are on day shift on the day of our visit, you guys are feeling good about talking to those appraisers. If they come around, you know, they are just going to pull people. So we want to make sure that you guys are feeling good about like what information you can kind of brag about the unit about. So just a couple of examples, harms prevention. So preventing happy skin. We do skin rounds Tuesdays and Saturdays. We have skin prevalence. Any pressure injuries, we report to Happy Red Cap tool, and we do Safety Always to track that. And then our CLABSI rates. So 365 days without a CLABSI. We do our hourly rounding, all of our processes around like sterile line changes and dressing changes. Pick RNs, rounding on our central lines, and charting on them in Cypher to track performances and areas to improve. Okay, if you guys have any questions about that, we do have like magnet champions on the unit, so you guys can ask. Like Nicole Burkhart is a magnet champion. I believe Colleen Thomas. Carly, correct me if I'm wrong. As well. But so, you know, ask your unit supervisors, come and ask, you know, our education team, all of that good stuff if you guys have any questions. Calling out. So just another kind of little housekeeping tidbit. Just want to make sure everybody knows like our policy around calling out. So each unscheduled absence is one occurrence. Multiple unscheduled absences for the same reason or consecutive shifts or work days will be considered one occurrence. So if you are scheduled, you know, Monday, Tuesday, Wednesday night shift, and you call out on that Monday night, if you then have to call out Tuesday and Wednesday as well for the same, you know, you have the flu, you have COVID, whatever it is. If you have to call out for all three of those shifts, it only counts for one occurrence. It does not account for three. If you are too sick to come to work for 2 or more consecutively scheduled shifts, we already talked about that. That is one occurrence, one unscheduled absence. You do have to call out for each shift separately. So again, that Monday, Tuesday, Wednesday scenario, you cannot call Monday, you know, afternoon and say, I'm calling out for all 3 of my shifts this week. We do want you kind of keeping a pulse on yourself, reevaluating for each shift and letting us know, okay, Tuesday, I'm still not feeling well enough. Wednesday, still not feeling well enough. So just make sure that you are calling the unit supervisors for each unscheduled shift. 3 unscheduled late arrivals or 3 unscheduled early departures or any combination is also one occurrence. So when we say occurrence, that is how we track. Occurrence is just like what we call those, you know, events. So it's, you know, one call out is an occurrence, but then like if you're late to work, we give you 3 late arrivals before it's one occurrence. Okay. We did just make an update to our weekend call out policy. So we have our unit supervisor, if our unit supervisors identify a pattern of this, each team member will be permitted 1 occurrence prior to needing to make up a weekend call out shift in the rolling year. So if you had to call out for tonight, your rolling year would start, and you know that would be 1 occurrence until February 27th of next year. If you have a call out on a weekend following that within that rolling year, then that you would go back to needing to make up that weekend shift. Again, same rule applies with the occurrence situation. And then we've just listed like our weekend shifts down here. So Friday PM, Saturday AM and PM, and then Sunday AM and PM. So now I just really want to hear from you guys. Want to hear how things are going. Want to hear, you know, if you are starting to take on more acuity, if you've started precepting, maybe being a fill-in preceptor. I know occasionally we do have newer team members who, you know, are helping out with our new hires. How do you stay motivated? What's keeping you like excited about coming to work? What are your favorite things about work? What is the hardest thing about work? So you don't have to answer all of these, but I do just want to hear from each one of you. I am just going to stop this presentation. You guys can still see that screen though, just so that I can see you guys on the other end. So just want to hear from each one of you in no particular order, and you can answer one or two or all of these questions, whatever you want to do, but just want to have some open forum talks. Would anybody like to go first? I'm going to call on somebody if nobody volunteers. Lan, did
I could start. Hi. Oh,
Okay,
sorry.
thanks.
I'm driving right now, so I can't turn on my camera,
Oh
but
yeah, no problem.
so far I think it's been good. Like I've definitely been able to take on like higher acuity, which I appreciate. Like I'm getting a mix of everything. How do I stay motivated? I guess just coming in like every day to work with like a fresh attitude and like just being prepared for anything and being willing to even offer my help and also ask for help when I need it. My favorite thing about work, my like are the babies obviously, but also the people, like people in my cohort. I feel like it just makes it so much better and like more enjoyable to go to work.
Yeah, to have your friends. I love that. How are you feeling? Are you feeling supported when you've gotten those like opportunities to have that higher acuity?
Oh, for sure.
Good.
Everyone's been really helpful, which is great.
Good. I love that. Wonderful. Well, I'm glad to hear that. I'm glad to hear that you love working with your friends. Yeah, that's wonderful. Who would like to go next?
I can go.
Okay, thanks, Lori.
I've definitely seen, I think I'm getting more acuity lately, which I kind of like. And like my last 6 or 7 shifts, I hung UVCs, which I hadn't done since orientation. So I kind of got in the role of hanging it every single shift when I came back. So it's gotten a lot easier now. But so I've liked that. I've also liked recently with the other cohorts coming off of orientation, people have started asking me for help, which at first I thought was a little odd, but then I felt confident enough to actually help them with whatever they needed, but it was still kind of weird.
Yeah, absolutely. And you guys will see that, as the next like slew of people come through, you guys are gonna, very quickly start gaining that confidence, gaining that experience. Just always keeping that good pulse on yourself. If somebody comes to you, you don't know the answer, it's just as beneficial to teach them like, hey, it's okay not to know. Let's escalate this to our charge nurse or whatever. But I love that you're getting that confidence in teaching and being that resource and being that support system for our new team members. I love to hear that. Okay. Who would like to go next?
I can go next.
Okay.
Sorry, I had my camera off because I also just got off.
It's okay.
But okay, going down the list. I felt like a little bit when I started out, I was stuck in 3 baby land, but now I'm finally getting a little bit more acuity, which is nice. I feel like I haven't precepted anybody, but kind of relaying off of what Lorraine had said. It's nice to now like be able to time manage well enough to like assist other people if I don't get that acuity, so then I can also help like someone if they have like a Novocaine or something of that sort.
Yeah.
How am I being successful? I'd say just kind of looking at what both like my kids have and then what like other people in my neighborhood that night have and seeing where I can kind of interject myself to practice things more. Staying motivated. I kind of agree with Leanne on it's really nice when you come to work with babies. I have a lot of friends who have adults and have some horror stories. So it's fun to come and have fun in babyland and just be positive about learning new things. And I guess that kind of goes along with my favorite thing about work is working with new people and getting to know them as well as the people in our cohort, which is always awesome. I'd say the hardest thing about work is really just getting used to like I had my first UVC and an MRI in the same night. I was like, help to charge, basically. So sometimes like you still kind of feel a little bit like you're out of control in the sense of it's a lot of learning and relearning things that just I haven't seen or done in a while. But also, if you look at it positively, then I've been trying to, so it's definitely been helping with everything. So yeah.
Yeah. And I love that. I think, it's a great kind of reminder that you guys are never going to stop learning. It's going to take a very long time for you to come in and be like, anything can happen on the shift and it's going to be okay. It's going to take a really long time to feel that way, and that's okay. But I think, like you guys said, cannot emphasize enough, continue throwing yourself into those experiences. Like Lorraine said, you hadn't hung a UVC since orientation. A lot of the times we go through lulls with acuity where if you don't use those skills, you truly do like feel so rusty coming back to them. So continue to advocate for yourselves, especially with us like onboarding such large groups. It can be so easy to get into a rut of, oh, well, there are orientees here that need to practice line change. So like, yeah, you can hang my line, and then all of a sudden it's been 3 months and you're like, oh my God, I haven't hung a line in forever. So I love that you guys are, it sounds like, throwing yourselves into those situations and really leaning into the uncomfortableness of like the new things or the things that are like that you haven't seen in a while. I love that. Okay, Bridget or Lindsay, would you guys like to share?
I can go. Can you hear me?
Yep.
So definitely starting to take on more acuity, yes. I feel like I've had a good mix of things, but lately getting more like NIV Nava kids. In terms of being successful, for me, I really like to read the notes in depth just to know exactly what's going on with my babies and any questions that I might be able to answer either for another nurse or the providers or something that I can pass along to day shift. And then also like reading the education material, especially with the NIV Nava. I didn't really see like a ton of that on orientation, so kind of refreshing myself on what some of those numbers mean. My favorite thing about work, of course, the babies, but like Leanne said, friends. It's nice that we're all kind of on night shift now, so we have buddies in our neighborhoods and stuff like that. But yeah.
Good. I love that. Have you guys been able, do you feel like, I love that you guys have your like, close knit of your cohort, but do you guys feel like you have, do you guys feel like you've kind of like branched out, you've met people outside of your cohort? Because we also want you to find comfort and like enjoyment out of the rest of your team members as well. Anybody can answer that question. Do you feel like you've been able to meet and connect with some other people? Or are you like, no new friends? We're good.
I definitely feel like I've met a lot of people, and it's nice working with the same people, especially when you're doing back-to-back shifts, because you get in a good rhythm. Like, I'll help you with this if you help me with that.
Yeah.
So it's nice when you look at the schedule and you see who's on the same shift as you or who's in the same neighborhood. 'Cause you're like, oh, this will be a good night. I know these people.
Yeah, absolutely. Good. I love that. Yeah, and I always tell everybody, this never goes away. Don't alcove yourself. It's like I feel like it'll get you stuck in a rut. It will not allow you to like meet people. It won't allow you to like see where people's strengths and weaknesses lie. And I think that is really what like is unique to our team. It really brings us all together is, there will come a time where you come into a neighborhood and you know that you have like, a PIV queen in your neighborhood or, whatever. Like everybody's got their own little niche skills. So getting to learn, where everybody really soars is important. Lindsay, are you at a place that you can unmute?
Hi, can you hear me?
Yes.
I feel like I've kind of been stuck in Three Baby Land, but that's okay. It gives me more time to go around and like help people, and like learn new things because I don't have to worry too much about my babies like in between the care times. And then also it always feels good to like notice like changes and stuff, and if there is like something that makes them start to be more acute. And I've gotten lots of practice with PIVs with Three Babies. And then my favorite thing about work is obviously the patient population. I love coming into work knowing that I'm gonna have like really cute babies. The hardest thing about work is like if I ever come into a shift and it's not a great start. I've kind of had like this trend of having infiltrated IVs coming into my shift. But yeah, it's pretty good. Now I know a lot about how IVs look before they go bad, so not
Mhm.
always a bad thing.
Yeah. I'm sorry that you've had some rocky starts to your shift. I think that that is like how you start your shift really sets the tone for the rest of it. I think that that's so true. But I love that you're able to see kind of the escalation and obviously, you know, those things have been caught. So that's the most important thing. I hope you feel like proud that you're, you know, doing well for our patients and kind of intervening where you can. Okay. Anything else last minute? Anybody wants to share? Everybody feels good. They've said their piece. Yeah. Okay. Getting back to our slides. I'll just leave it on this view. Okay, everybody. Okay, so going into some feedback that we have gotten just in general, not even about, you know, since your cohort has come off, this is, you know, just consistent across the board. Always wanting to make sure that we have tidy rooms and tidy babies. So make sure that you are seeing things through the eyes of the parents. You know, always making sure that you are not, you know, if your baby is like spits up or anything like that and you have to run off to your next care, don't be the nurse who just like throws a burp cloth over the spit up. Take the time to like change the sheets and, you know, delegate as you need if you're running behind. But just make sure that we're keeping everything nice and tidy and organized, so that we're, you know, everything looks neat. Retiming medication. So this has been a big one. Really for a long time. So we just like added a little example. Gentamicin due at 7:05. What would you guys do with this medication? Would you retime this med? Would you reach out to pharmacy? What would you do? When would you give it? Anybody can yell out the answer. Anybody?
You're always supposed to give the antibiotic earlier.
So what do you mean by that? Earlier when? When would you give it?
Like, I want to say it's 20 minutes for Gent. I could be wrong. I only have given it twice.
Yeah,
It's been a
so
while.
there is a grace period of about 30 minutes, but we want to make sure that we like antibiotics are like a time sensitive medication, right? So they don't really fall into that category. This really is a time sensitive medication. So 7:05, obviously the reason we highlight this is because that is like the most inconvenient time ever, right? You're right in the middle of report. So I would give this med, like I would give it right at 7. You know, people are scrubbing, people are at the scrub sink, you know, they really don't get over to you until about 7:05 anyways. So I would pull it, go into my room around 6:50. I would be like setting up my pump, scanning in my medications, you know, getting it checked off with another nurse, all of those things. So that way I'm not like, I would not interrupt report to do this. Like I would want to give this before an report started, but find that, you know, find that good period where we can give it, it's on time, it's not past that like you know, little threshold. And then also we're not like giving a choppy report, things like that. We just like to highlight this because I think our whole team, not just, you know, newer nurses, our whole team gets very comfortable with retiming like vitamins and, you know, supplements, things like that. So just making sure that you guys know that when we don't, you know, polyvisol is very different than an antibiotic. We want to make sure that these medications are not retimed, similar to like narcotics. If you have scheduled narcotics, those really should not be retimed either. Okay. Medication checks. So always making sure that you're doing your 5 rates of medication. So right patient, right dose, right route, right time, and right med. Never get too comfortable. When you get comfortable, that's when mistakes are made. So always make sure that you're continuing to do your due diligence, checking Neofax. if you haven't given a med in a long time, you know, looking it up, making sure that you know the side effects, making sure you know all the ins and outs of what goes into that medication. Desaturation. So we have, actually, this is something that like our patient safety navigator, Lori Richardson, is working on. So real desats. Always want to make sure, biggest takeaway of this is that, you know, we've had a lot of providers say that, you know, well, this nurse charted this desat that lasted for 5 minutes, you know, to 88, or 5 minutes, 5 seconds to 88. But the baby was supposed to go home the next day. So we just want to make sure that there is no, like discrepancies with what our charting says and with what's going on with the baby. So just making sure, again, you're doing your due diligence. Biggest thing is going to be your assessment. So if you see that the monitor is dinging off, whatever it is, always making sure you're getting your eyes on your baby. You know, if your baby is satting in the 70s and the 60s, they're going to be blue. You're going to be able to see that in your assessment. So just making sure that you're getting your eyes on your baby so that you know that it's not just like, you know, your monitor or your pulse ox, your leads are not reading properly. When they're chartable, so I think, Carly, correct me if I'm wrong, I think that we landed on 20, like if they're 20 seconds, or is it 10 seconds? 20 seconds.
20, yeah.
So a desaturation for 20 seconds, or if you have to stim the baby. So if you have to, you know, maybe they came out of it at 15 seconds, but you had to intervene and it was clear that they were not going to come out of it on their own. That is also a chartable event because, you know, we had to intervene and do something about it. So just making sure that you guys are kind of, you know, dotting your I's, crossing your T's on that in that regard.
We also have that work group, Jordan, if you wanted to plug that. The work group that like each facility, like we're coming together as like a system, like Inova together, like Alex, Fair Oaks, Loudon, like we're all getting together to, there's a work group that's actually like coming up with, you know, making sure that like our chartable DSATs that we have stricter criteria. What Jordan was going over is what criteria is now, but we do have a work group that's going to get more specific into that nitty gritty of real DSATs, what's chartable versus what's not, things like that.
Okay, so vaccines. So we did have a process in the past where, you know, we would give our grouped vaccines together. So we would give them, you know, throughout a week. So let's say we had 3 vaccines to give. We would give one Monday, one Wednesday, one Friday, just to kind of space them out. There has been a lot of back and forth with, you know, nurses being very comfortable with that process, but our doctors wanting all of the vaccines given in one day. So we have done a little bit more investigating on this, and we have heard from our provider team that the literature supports really giving all of the vaccines at the same time because it just beefs up that kind of immune response for our patients. So we always say, you know, have a discussion with your provider. We've also seen on the flip side of that where if we have like a very chronic, very critical patient who is going to be with us, you know, it's not like we need to get them out the door for discharge, anything like that. If you truly feel like your patient is not going to tolerate it, just having that conversation with the provider just so that you can kind of make sure that you guys are talking through all of the possibilities. But more so we are moving towards a place of giving like all of those vaccines on the same day. No hands-on care with the door closed. So just gotten some feedback that on night shift, it has been noticed that some nurses are, you know, in their rooms with their patients with the door closed. Occasionally we have heard that, you know, when people have gone in to check on them, people are like watching movies on their phones, they're listening to music, whatever the case is. Really just for your guys' own like safety, and we don't want there to be any like, you know, reason to doubt anything that's going on. Just leave the doors open unless the doors really are there for like patient or parent privacy. So, you know, if a mom is breastfeeding, doing skin to skin, mom is sleeping, you know, whatever the case is, absolutely keep the doors closed for her privacy. But if it's just you and the baby in there, we just don't want there to be any reason for anybody to question, what's going on. So just keep the doors open. And it's also a safety measure, if the baby starts desatting, having an event, anything like that, it will be easier for you to call out for help if that door is open. Okay. Questions. So again, we talked about this a little bit with our little share session. So always make sure you're asking somebody with a higher level experience if you are unsure about something. We know that you guys have such close relationships within your fellowship, but really want to make sure that you guys are going to somebody with higher level of experience. We don't want two people from the same fellowship helping with an IV stick. We don't want two people from the same from the same fellowship troubleshooting something if there is somebody with higher experience in the neighborhood, just because you guys don't know what you don't know, and we want to make sure that you guys are continuing to broaden that knowledge and getting to the right answers. Okay. Make sure you're reading your orders, going through them every shift, making sure that you are fully understanding them, all of that good stuff. Little tidbits of transpyloric feeds are always continuous, always making sure that these are things that we don't have very often, so it can be very easy to kind of get caught up. And then with the fine print of our feeding orders, they can be very wordy, so just make sure we've had situations where the providers have gone from bolus feeds to bolus gastric feeds to continuous transpyloric feeds. And in the order set, there are 2 places where it says the time frame. And so maybe the time still says, over 2.5 hours, but in the fine print of the order, it says continuous. So just make sure you guys are doing that due diligence. If feeds are transferred to transpyloric, they should always be continuous. Just making sure you're doing that double check for yourself. And then fortification of breast milk. If you don't know the progression of steps, please ask. We want to make sure you guys have a good understanding when you're educating parents, good understanding for yourself of kind of where the baby's going and what the next steps will be. Okay, competencies. So we have 2 competencies kind of out in the wind right now. So your Car Seat Challenge competency and your PIV competency. Congrats to Lindsay, Leanne, and Mary. You guys have all finished your Car Seat Challenge competencies. We love that. You guys are ahead of the game. Please make it a goal to finish this in the next 2 months. The Car Seat Challenge competency, really, I feel like all of you guys have probably seen a car seat. Has anybody not seen a Car Seat Challenge or has not had the opportunity to do one? Anybody? Has everybody's done one and been checked off?
Question about being checked off. I've done 3 of them, but I didn't know we had a paper or something that we needed to have signed to get checked off.
Yeah, so if you remember in system skills classes with Lisa Robinson, so one of your skill stations, do you remember where we put the baby dolls in the car seat?
Yeah.
So that day we gave you guys all a car seat, Car Seat Challenge competency form. So that is a competency that we have on our unit. Your first Car Seat Challenge on the unit should have been observed and checked off by another nurse, a more experienced nurse. So just make sure whoever you've done the Car Seat Challenges with, whoever's signed them off for you or overseen them for you, you can just go. But do you still have that paper by chance in your binder? If not, I could send it to you.
I probably still have it. I'll just go
Okay.
back. I did them both with Cindy, so I can
Okay.
go back.
Yeah. If you look in your binder and you don't have it, just shoot me an email. I can send you a blank copy.
Okay, thank you.
Okay. But so I haven't heard from anybody else that you have not gotten the opportunity. So please get those signed off, those papers that I'm talking about, get them turned in. They do need to be turned in by the time that you come to your off orientation competency, which we will talk about in just a couple of slides. Okay. And then your PIV competency, where are we at with that? Have we been able to get our observations done? Have we started practicing inserting? Anybody want to share where we're at with that?
I've inserted 1 and attempted twice.
Okay, wonderful. I love that. This one we know takes a little bit longer just because it's a little bit more that you guys have to do. It's a little bit more involved. You have to get your observations and then you have to do 3 sticks and they have to be successful. So please just make this a goal in the next couple of weeks. We want to make sure that you guys are, again, advocating for those experiences. If you know that there's an admission in your neighborhood, ask if you can be the one to, you know, do a stick and just see how it goes. Again, goal is to get this turned in by your off orientation competency. Okay. So mandatory annual competencies. Our leadership and education team has created a mandatory off orientation competency for all of those who graduate from the fellowship, which is all of you guys. The competency ensures that best practice and appropriate skills are being implemented. It is very similar to your on orientation competency. We'll go over kind of the ins and outs of what we're going to do during the competency. It is April 28th. The Monday of that next schedule that's going out. That schedule opens for you guys to schedule March 6th. So we will communicate this with Jackie and the scheduling committee that you guys should not be working the night before or the night of April 28th. But please also do not schedule yourself on those days or on that day so that we can accommodate you guys coming. We will meet in the middle conference room just like normal. If you have any scheduling conflicts, like pre-planned PTO, pre-planned vacations, things like that, please let us know. We're happy to work with you. But we do ask that you guys prioritize this as it is like part of your, you know, roles and responsibilities with the unit. So during this off orientation competency, we are going to do our document collection. So we're going to be expecting you guys to turn in your PAV form, your car seat challenge form. So please make sure you get those signed off. We're going to do another central line competency. It's going to be the exact same as the one that you guys did on orientation. Again, just to make sure that we are continuing to practice healthy habits, that we're continuing to get those, all of those things under our belt. Like I said earlier, you know, we know with such large fellowship groups, it is, we hear a lot when people come to off orientation competency, well, like I haven't hung a line in a couple of months. And we know that the reason for that is because the orientees are seeking out those experiences. But do not be afraid. You guys are still, you know, you're still learning, you're still new. We still want you guys to be practicing all of these skills. Lines are something truly that if you do not practice, you are going to lose that skill. So it is okay to tell an orientee, I need to hang this line. I need to continually keep up my skills. You know, we don't want you guys going months and months without practicing this this skill. Okay. We will do a medication test, same as your on orientation competency. You need a 90 to pass. It will be open note, same as the competency you did on orientation. You can use Neofax. Any handwritten notes that you have, Teams now will be available to you, and all of that good stuff. And then we've also implemented a mock code. Again, as you guys are getting more acuity, you're getting more exposure to those higher acuity assignments. We just want to make sure that you guys are feeling comfortable with like the steps of responding to an emergency, since you probably haven't seen some of this stuff since NRP, like very early on in orientation. That is not a competency. It's not a pass or fail. It's just like an educational tool that we have for you guys. Okay. It's a chance for you guys to like get your hands on the equipment and to make sure that you like get all of your questions asked if you have any questions about how to do the steps of NRP. Okay. So goals that we would like for you guys to just like some soft goals for you guys to have for yourself. We want you to take stable. This is stabilization of a sick or premature infant in all settings. Just a really good course that helps like kind of pull everything together with why we do what we do on admission. Stable stands for sugar, temperature, airway, blood pressure, lab work, and emotional support. Our summer classes for this are being planned. It is in person every other month, and we rotate care sites, so it may not always be at Fairfax. We are getting the next edition, so I do not know when the next full length class will be. But that will be announced like and look out in weekly updates and things like that. Okay. Make sure you guys are attending UBC. UBC, we go over all of our like unit specific things, any projects that people are working on, any like pertinent information to the unit. Please make sure that you guys are attending UBC. It's the second Thursday of every month. So next month it will be March 13th. And then if you guys are interested in starting to precept, so we do have the opportunity for you guys to, we have some students coming. So if you're interested in kind of dipping your toes into the precepting world with a student, it's kind of a nice way to get your foot in the door with that. It's kind of like low stakes, they're really just observing and kind of doing like those shadow shifts with you. So if you're interested in that, please reach out to me, Carly, or Sarah. And then precepting for our fellowships. So when you guys hit a year, we will start asking some of you to precept, just because we think that it is so beneficial for our new hires to see, it's okay not to know everything. I think that it's just as beneficial for them to be with somebody who's new, who is saying, oh, well, I've never seen this before. So here are the resources that are available that we can look up. So just wanting you guys to know that that is going to be coming. But if you guys are interested in kind of dabbling with precepting first, we could set you up with a student. So just let us know if you are passionate about that, like teaching, things like that. Okay. And then committee involvement. So finding your passion. You guys can join once you've hit a year. So if you have found, that you're really passionate about skin, or you're really passionate about, our CLABSI stuff, things like that, there are committees for everything on our unit that you guys can reach out. We have that, the boards in that hallway that lead to our break room that go over like who is on each committee, who the heads are. So if something has stuck out to you in that regard, we can have you reach out to that committee chair to get involved with that. Okay. Attending mock code. So we do hold these every other month, the last Thursday of the month. There are day shift and night shift options available for those of you who rotate. The next one will be, it's today. 1 in the morning and then 1 in the evening tonight. Location is always announced on the day of. So just make sure that you guys if you guys are here for these shifts, or if you're interested in coming outside of your shifts, make sure that you guys are attending these, because they're so beneficial for your knowledge. I think the first time that you are involved in any kind of like MSAT, things like that it is your patient, it's always going to feel very uncomfortable. It's always going to feel very stressful. So just getting familiar with the materials or the equipment that we use, getting comfortable with the steps of all of that stuff is going to be so important. So please make sure you're advocating for yourself in this regard as well. And then training goals. So SBU, you can take within 1 year off of orientation. So I think the next class is going to be held November of 2025. They have not announced that schedule just yet. Cooling class you can take when you've hit 2 years, so July of 2026. Become a super user. So we constantly have new products rolling out, new initiatives. We do have one with heel sticks that is going to be announced on UBC this coming month. So if you are interested in kind of getting involved on the unit that way, please feel free to do that. And then one thing that we did not list on here, but just also want to add, is any certifications, like getting on the advanced clinical ladder. If you guys are interested in that, ELBW you guys can take after you've been practicing for a year. And then RNC you can take once you've been practicing for 2 years. So if you guys are interested in that, you can apply to take those and kind of broaden your knowledge that way as well. Okay. That is all that I have for you guys today, as far as our presentation goes. So really last little bit, just want to see if anybody has any questions about the off orientation competency, questions about anything that we went over today. Want to talk about things on the floor, please, like the floor is yours. Just want to make sure we give you guys some uninterrupted time if you have any questions.
I also wanted to plug really quick, if, when Jordan was talking about precepting or education, if that's something that is a passion for you guys, we do have Helping Hands for fellowship, especially since you guys just recently went through fellowship. You guys know, the skill stations that we go through. We always provide the support of like a script and the content, especially if it's your first time covering that skill station. And it's things that you can use towards, advance hours when you guys get to that point. And, just ways to get involved with, again, education, meeting the new team members. So please let us know if you're interested in that as well.
Yeah, absolutely. Oh, thanks, Ellie. Okay, anybody have any questions? Everybody feel good about the expectations with the off orientation competency? All right, that's all I have for you guys. If you don't have any questions, if you